Hi, everyone. Patricia, I think we're good to go.
We're good? All right. Bonjour tout le monde. Good morning, everybody. My name is Patricia Walsh, and I sit on the board of directors of the Ottawa branch of the National Association of Federal Retirees. On behalf of the Ottawa branch, I am delighted to welcome you to our first Healthy Aging webinar called Remaining in Your Home, How to Stay Safe While Living in Your Home with Amy Friesen. Au nom de la section d'Ottawa, je suis ravie de vous accueillir à notre premier webinaire sur le vieillissement en bonne santé. Please note that the webinar will be presented in English, but participation in both official languages is strongly encouraged. Also, the webinar will be recorded and you will receive an email after the presentation with instructions on how to access the video at your time. Now, before we proceed any further, I want to mention that your association is having another mega recruitment drive this year. We are asking for your help to recruit new members. There will be great prizes for referring new members. The grand prize, which is totally amazing, is $10,000 cash, courtesy of Johnson's Home and Insurance. So every time you successfully recruit a new member, you will get a chance to win this and other great prizes. No matter what, you will always receive a $5 coffee gift card. You really can't lose, and your association and your Ottawa branch can grow. After today's presentation, our branch will send you a separate email with further information on how to participate in this mega recruitment drive, information, and other webinars coming up as well. Now, let me introduce our presenter for today's session, Amy Friesen. Amy is a best-selling author and expert in the retirement living industry, where she has been working for the last 17 years. She has worked with seniors and their families throughout North America. In 2014, Amy founded Tea and Toast, a local search service for seniors specializing in retirement and long-term care homes. The personalized service advocates for clients' needs, personal wants, while simultaneously ensuring their short-term and long-term goals, as well as needs for care, are included in the plans. Amy educates and speaks to the community and local businesses regularly about retirement living industry and its complexities. She has been recognized for numerous awards. Most recent, the House of Commons 2018 Business Year Award. As well, Amy was well known locally for her assistance with organizing and providing seniors during the 2018 tornado, as well as for her participation in Santa for Seniors program. In 2019, Amy received one of the city's 40 Under 40 awards, and she received the Women's Business Network Emerging Businesswoman of the Year Award. Amy's Tea and Toast team was awarded Corporate Engagement Award of Excellence from the Good Companion Senior. Please join with me in giving Amy a warm welcome.
Thanks, Patricia. Thanks very much. Hi, everyone. We're just going to turn off our videos now so you can have a look at just the screens. Okay, perfect. So welcome. Thanks again for the introduction. Making sure we're all up and going. That's perfect. So as Patricia mentioned, my name is Amy Friesen, and my background is in marketing and psychology, and I've been working in the retirement living industry. I've been an educator and speaker, as well as running Tea and Toast for the last 7 years. Wanted to tell you just a smidge about me so that you know who's presenting today. This is my husband, Mike, and my little one, Eva. And she is definitely a handful. We've been going through a lot of different things that parallel my work with seniors, specifically of recent, going through the process of video touring daycares, which I'm video touring retirement homes with my clients currently as well. Also, I'm a pet mom of Levon and Mabel, as well as Ruby and Sigmund. I'm an avid cook as well as photographer. And if you weren't impressed enough already, I am also a 2-time tractor pull champion. But on a more serious note, I have 17 years experience in the retirement living industry. I started in long-term care and have been working in the homes as well as in my own business over the last couple of years. Throughout my years, I've helped over 1,000 families find retirement living as well as give advice to them on their own paths. I've also been a speaker for the last 5 years. Often we do this in person, in front of large groups, whether it's in the community or for different businesses. But I have been doing that for the last 5 years. And webinars, of course, are newer to the retirement living industry, but I think we'll do just fine here. As a bonus, if you stay to the end, I will have a free download for you, which will give you a lot of different information. So I'm going to talk to you more about that at the end. So please stay all the way through. Now, we're going to start today by talking about your care path. And your care path can look many different ways. These are visual representations I like to use when I'm talking about different home styles. We have your home, we have retirement living, which I always call a cruise ship on land. And I have a visual here of an Ohio nursing home. And this is a dementia care setup so that they look like the front porches, so that they're a little bit less confusing for folks that live there. So your path can take a few different options. You can go from your home to a retirement home to a long-term care. Now, if you go to retirement, you're going to be focused on social and interaction and being with your peers, and then into a long-term care home with added care. Or you can also go from your home to long-term care. And the long-term care I'll talk about a little bit more, as well as retirement living, but it's a little bit more facility-like. So you can do a couple different options, as well as today we're going to talk about how to stay in your home for the long term. So what type of services do you need? What is your plan? And we're going to start off by talking about health and your healthcare possibilities in your home. The LHIN, which many are familiar with, are called the Local Health Integrated Network or Integration Network. And they have 14 LHINs across Ontario. They're funded mainly through tax dollars, and they also offer subsidized services through the community. Types of services that the LHIN can offer in the community include things like health, meaning the healthcare professionals, so nursing, physio, social workers, as well as personal care, such as bathing and dressing. They can do homemaking services like laundry and cleaning. And then, of course, they can do end-of-life care as well. A lot of folks choose to go palliative into a different scenario afterwards, but they can also help at home for end-of-life care if that is your wish. Is there an assessment process? The short answer is yes. In order to get assessed by the LHIN, you would need to contact the LHIN and to see if you qualify and discuss your case with a case manager. And they would then arrange a home visit and you would apply for care then. Now, a question that we get often is, do I need my doctor to put the referral in? No is the answer for that. The referral can come from anyone, including friends and neighbors and family, or yourself. So you don't have to go to a healthcare professional specifically to get this referral. Now, let's talk about home care, as in private home care. And private can include both formalized companies and private caregivers. A company is an organization that has multiple care workers and ranges from companion care all the way up to nursing care. An individual are often companions, and a lot of folks find individuals in the community through Kijiji ads and things like that, or just friends of families. And so you can look at these people to come in privately. Most often they're companions, and sometimes they're PSWs. Most often people don't look for nurses this way. And I'll get into that a little bit more. But basically, when you're looking for a home care provider, you need to figure out what care services you need, including whether it's companion care, whether it's a PSW to help with bathing, as we talked about with the LIN, or whether you actually need help with medications. So when you're looking at a company versus a private individual, one of the main difference is medications. The company can have a nurse come in and do medications. They can also do reminders. A personal person coming in from the community often can only do medication reminders. They can't physically give you the medications. So what can home care offer? Well, they can offer the same types of services that the LIN can offer, but as you can expect, because it's a private pay, they can offer a lot more time, and you would just pay them individually. So services that I've listed here are companionship, personal care with a PSW, the nursing care for medications, housekeeping, transportation, and so much more than that. Again, they can also offer a lot more time. With the LIN, you tend to be capped with the amount of time that you can get for the services, whereas here you're going to pay for them, so you can pay for as much services as you would like. A main question that I get often is, should I hire a company or an individual for home care? And some of the things that you should consider are ministry protocols specifically for COVID, but also insurance. Now I'm going to switch over here. I have a video from one of my care providers, and I'm going to let her talk to the things that you should look at when looking for a home care, and then we will speak again after this.
Hi, my name is Christine McGinn, and I am co-owner of Assurance Home Care. We are a boutique-style home care provider servicing both Ottawa and Toronto. We offer a full spectrum of home care services, from companionship straight through to palliative care and end of life. Here are 5 questions that you would want to ask a potential home care provider before hiring them. First and foremost, number 1, you want to look at the quality of caregivers that will be actually providing the service to you or your loved one. With regard to that, it is important to ask a home care company what skills and qualifications they consider valuable for caregivers. In addition to that, and beyond the skills and qualifications, what are their core values, and how do they tease out those core values to hire the right people who will be providing care. In addition to that, in regards to caregivers, you want to ask if it is important to you that you have the same caregiver over time. Ask if that is something that is possible for you to have. So some home care companies don't promise consistency, but we do find establishing a rapport over time with one caregiver is an important feature in ensuring that good quality care is provided. Secondly, you want to ask about the supervision for the caregivers. With regards to that, you want to ask who is providing the supervision. So at Assurance unexpectedly and they need an opinion, or in terms of coaching and mentoring, if there's something in the field that a caregiver has a question about, our nurses can go in and answer those questions and help coach and mentor. Number 3, communication. What is the communication policy of the home care provider, and are they willing to customize that to suit you? So for instance, if you are an elderly person in Ottawa receiving care from a caregiver, then you have a daughter who is your financial and health POA, and you want her to receive information with consent. You should be able, the home care company should be able to provide updates that provide peace of mind to family members. During this time, as we navigate through this pandemic, number 4 would be to ask specific questions about the home care company's COVID-19 protocols. Every home care company should have their protocols in writing and should be able to provide that to you before providing service, so that you have peace of mind that every precaution is being taken to ensure the safety of you or your loved one. Number 5, ask the home care company if they provide a full spectrum of services. So if you start off with something like housekeeping or companionship, or you need transportation somewhere, but you are expecting that because of your age or your loved one's age or illness or disease process, that you may want to add on services, it is a nice feature to be working with a home care company that has a full spectrum of services, so that you don't have to switch out should your loved one require a different type of care that is not provided by the one that you chose. I hope you find this helpful. Thank you.
Okay, so I'm going to rearrange our video here just a second. And I think we're good to go again. I hope you could hear that. This is the first time we tried to put in a YouTube just so that I could give you some extra information. Just to end off with a private home care company, you can also possibly claim some of your nursing care on your insurance, your life insurance, with your life insurance companies through the long-term care insurance. And so make sure that you're looking for that in your own insurance programs. Just briefly, I'm going to let you know that we are going to answer questions at the very end. And if you hover over the bottom of your screen, you'll see a Q&A section, and you can add your questions in there just going forward. Okay, so we're also going to talk just briefly about family and friends being your caregivers. Now, a lot of families do pitch in, and often they're doing groceries and they're doing appointments and helping with medications. But you need to be aware that it can get quite gruesome and in time-wise, because the family members are also taking care of their own families and yourself. And some of my clients have had to stay with their loved ones for extended times because they're trying to not make a move, but in order to do that, they need to make sure that they can get the care provided properly. Which leads us to our next conversation about dementia. So this is often what I hear from clients that we're working with. My loved one has dementia. I want to keep them home as long as possible. This can be great for a certain amount of time. However, I often see things change quickly and get quite complicated. Some of the concerns that come up when we're working with clients in the community are caregiver burnout, which is a huge concern. I'll talk about that a couple of times, but you need to be very aware of who is taking care of the person with dementia and their mental status, as well as their physical status as well, because they tend to get burnt out quite quickly, and it's a lot of care and worrying and undue stress to worry about when you're working with someone or caring for someone who has dementia. Often when folks are getting to later stages of dementia, they can become argumentative when trying to look at making a move. And so often people look before that point so that they can try to explain as best as possible, and the person with dementia can take it in as much as possible. The folks with dementia do tend to adapt better to a retirement home setting or a long-term care setting. I find the earlier you move in the situation, so in the disease. So if someone is in more of a mild or medium point in their dementia, then sometimes adapting them to a new environment is easier at that point. The longer you wait, the longer it takes to reason with them and get through to them that it's not a great idea to stay at home any longer. Sorry, I was just fixing a video issue there. Okay, so, and then stimulation is also something you need to take into account. Stimulation in the home, how are you going to make sure that the person with dementia and yourself is not only cared for, but also involved in activities, also involved in the community, and so forth. And in a retirement or long-term care home, they have these things all set up for them. So maybe taking a look into that, as well as day programs. They're called day away programs. That can also be helped, or also can help with stimulation. Medications and nutrition are also big determinants. Often folks are not taking their medications properly. Often they're not eating properly. Sometimes the caregiver doesn't know how to cook, or isn't able to, or is completely burnt out, like I said before. So making sure that those are managed properly will make a huge difference in the life of the person who has dementia. So I'm going to go on and talk to you about Irene and Bill. Irene and Bill have been married for 65 years. Bill has Lewy body dementia, and he started to wander. And Irene was up late at night worried, because she was always hoping that he wouldn't wander outside in the night, which he had done before. And so she wasn't getting much sleep. She's always keeping an eye for him. It was causing a lot of undue stress. It was heightening the aggravation in Bill, because Bill didn't understand why he couldn't go out anymore. And when I last heard from them, Bill was actually in hospital. And because they hadn't planned properly, and they hadn't made a move when it was a good time to make a move, when this could have been averted, there's limited solutions for him now, because he's so advanced, and his nutrition and his medication has all kind of gone down the tube. So he's kind of slipped too far into the dementia, and is currently still in hospital. Actually, they're trying to manage him. So this definitely has happened to a lot of folks that I work with, because they are waiting too long. So when you're planning out your care path, make sure that you're looking at all different scenarios. And we'll talk a little bit more about extra scenarios in the end of the webinar. Lastly, we want to talk about the importance of socialization, just staying at home, not even for dementia care, but for seniors who are staying at home. They want to stay there as long as possible. You need to make sure that you're not being isolated. Now with COVID, a lot of people have become more isolated recently, and we're definitely seeing the problem in mental health in the community, as well as our clients, as well as hospitals. We're all seeing this happen. And so make sure that if you are staying home as long as possible, that you are getting enough socialization. You're going out, you're having a walk with friends, of course, socially distanced at the moment. There's senior centers. The senior centers have things called Senior Centers Without Walls that you can do online or on the phone, just to connect with other people. And also with the day away programs I was talking to you about, dementia care as well. And again, caregiver burnout comes up here, because if you're somebody caring for an individual, you want to make sure that you're also caring for yourself. And part of that is being social and getting into your own environments again. Let's move on to speak about home renovation and aids, and things that might be required for you to stay safely in your home. Renovations and modifications can vary and include things such as bathrooms, which can be as simple as a raised toilet and as complicated as a whole bathroom redo. Redos of the home in general, stair lifts, grab bars, not only in the bathroom, but going out to the backyard, going in the kitchen, ramps, and flooring. Flooring, something that often people don't think about. But consider that a lot of people have lived in their homes for 60 years, and sometimes the flooring isn't the greatest flooring for walkers and wheelchairs, say. And so sometimes people have to replace that with hardwood or laminate. So things that you could ask your contractor, I spoke to one of my contractors, and this is a list that they gave me, and I wanted to make sure to hand it over to you as well. So of course, we want to make sure that the business has insurance for themselves, as well as their licensed sub-trades are insured. It's important to know who's completing the work, and if it's going to be somebody else, we want to make sure that they have a license and business insurance. The permits, whether you need to do the permit yourself or whether the contractor will do it. Also, you would like a detailed contract to know exactly what you're getting, exactly what you're paying for. And you want to look into what their pet policy is if you have pets, because I can tell you that you want to make sure that not only are they cleaning up properly, but they're aware of the pets and they're keeping doors closed and different things like that. I can say that we've had our windows done recently, and it's very important, as we have 4 pets, that everything is not only cleaned up, but after they bring the windows in, the doors need to be closed. And we're also responsible for taking care of our pets at that point as well. And so keeping them in another room might be a possibility as well, but just to keep aware of that. Briefly, to speak about some of the aids that might be helpful in your home. Every time I'm asked to consult with a family where they're looking to stay at home, Pendant Systems are the top of my recommendations. Pendant Systems have grown throughout the years. This picture here is of the basic Pendant system, which is a push button. A lot of commercials in the past have been the I've fallen and can't get up scenario. So this system can be worn on your neck, it can be worn on your wrist, as well as there's other companies that have GPS locating systems as well, and they can put even a small system in your shoe. So if you are worried about somebody wandering, you could always put a GPS system in their shoe. Walkers and wheelchairs. I like to talk about this just briefly because it's important that you are not stubborn when you're staying at home as long as possible. So either we're going to stay at home as long as possible and you have to be open to ideas of how to stay safe, or you might want to look at a different care path, because a lot of people aren't using their walkers and wheelchairs properly, and so or at all, to tell you the truth. And so if you're going to stay at home and you can make use of a walker or wheelchair and it's appropriate, make sure that you're taking up the healthcare professional when they tell you to do to use a walker, because a lot of people, like I said, aren't using them. Even a cane would be helpful, to tell you the truth. A lot of people are furniture walking, which is not sustainable. And alarm systems. Now, Irene wanted to put an alarm system on her door so she would know if Bill left. But alarm systems can also look like bed alarms. If someone has a fall risk and you don't want them to get out of bed, this is for folks that are staying at home but need a lot more care. So you could put a bed alarm on, which is a pad that you put on the bed. And there's also an alarm system for a wheelchair where if the person leans forward too far, the alarm will sign that there's a problem. And then that way it's just more so used for people who are fall risks and don't understand their limitations any longer. So these aids can help keep you safe while you stay at home. Let's talk about how long versus how much. How much money are you willing to invest to stay in your home, and how long are you looking to invest it for? Some of the costs to consider when remaining at home are renovations. So not only the renovations and how much they cost, but also what's the resale value if you do these renovations. I highly suggest that you should have your home evaluated by a real estate agent and talk to them about the renovations that you are looking to do. And maybe there are some suggestions that maybe you can still do a renovation that will make everyone safe, but maybe there's a certain way to do it and so that you can get resale value out of your home if you're looking to sell down the way. Home care can cost a variable amount of money. It depends on if you're going into the community for a private or if you're going for a company. Companies' home care, from companion all the way up to nurse, can range in and around the $25 to $35 an hour, depending on which company and what service you need. To do 24-hour care, I've had clients who have had a live-in caregiver, and they can also be less money if you're a live-in caregiver because there's someone there all the time, but also some people piece together caregivers for a 24-hour period, which is different than having a live-in. And so if you're getting 24-hour care, you could be up and around the $20,000 a month value. So be careful on what you're piecing together. And like I said, how long are you going to do it for? And is a live-in caregiver a better solution? And the companies can also give you solutions for live-in caregivers, and they can give you recommendations, and they can be in charge of them as well. So that might be a good option if you're in that situation where you need care around the clock. There's also additional mobile services that you can look at, but the cost is a little bit more because they're considered convenience services. However, they are terrific depending on what you need. So things like foot care that can come to your door, especially if you have diabetes and you need to stay on top of your foot care every 6 weeks to keep your toenails trimmed and your feet looked after. And also there's the veterinarians that can come to your door for your animals. There's grocery deliveries, and there's a lot of other things that can be taken to your home. Just keep in mind that, like I said, they are considered convenience services. So because they're delivering, there probably will be a charge for bringing it to you. And caregiver burnout. As mentioned previously, this caregiver burnout is real. It's a dangerous condition, and many people don't take it into consideration. However, there is a real cost both now and down the road for a caregiver who gets burnt out. So keep that in mind as a cost factor when you're looking to stay in your home. And I know I do mention caregiver burnout quite a bit, but it is prevalent in the community, and it's not spoken about enough. So just keep that in mind when you're having a look at all of your options. All right, so I'd like to talk about a contingency plan. I always leave all of my clients with a contingency plan, whether they are making a move and we're doing a whole situation and planning it all out. And there's multiple contingency plans that we talk about. But there's also whether you're staying at home and what the next moves are and how to map it out, a plan for yourself or for your loved one. So it's important that you don't just survive, but you choose to thrive and you know your options when you're living at home. If things aren't working out at home, there are other options that you can look at. When we work together, I can help you build an entire plan and give you strategies and next steps. And these next steps include looking to retirement homes and long-term care. And I'm going to go over these briefly with you here. My number one obstacle when I work with clients is the lack of education in the general public on the differences between retirement homes and nursing homes. So what is a retirement home? A retirement home is a privately run home that is run by companies and individuals. They have care from anywhere from independent, meaning your meals and your housekeeping can be taken care of, all the way up to palliative and end-of-life care. Now, not all buildings offer this, but in Ottawa specifically, we are lucky that we do have a lot of different styles of buildings that can offer a lot of different care levels. They allow people to live with their peers who have similar life experiences as well. And again, like I said, I call them cruise ship on land because you'll have a social director, you'll have all your meals with friends, and it's more of a home environment, a more social environment. The cost of retirement living depends on a lot of different factors. So who is moving? Are there one or two people moving? Spouses can stay together in retirement living. And so it's a matter of, do you choose different suites? Do you stay in the same suite? Now, if you stay in the same suite, there is a second occupant cost most often, and it's around $800. So that includes covering the second occupant's housekeeping and meals. It doesn't include their care though. So if there's care, there's going to be money costs on top of that as well. And suites go from anywhere from a studio up to a 2-bedroom. And there's also a couple of homes in town that do shared suites. So that's available as well. The cost does range. For independent without care, you're looking for studios somewhere around the $2,000 mark, all the way up to 2 bedrooms that, it could be $7,000, and then you add care on top of it. What type of retirement home? This does make a difference, whether you would like to have all the bells and whistles, the shiny penny type of homes is what I call them, or a homey home, an older home that still offers great care, but is not one of the brand new spiffy homes, like I also call them as well. And so that does matter, and you need to take that into account when you're looking at cost. When you move, the season also does matter, and also in your care journey when you move. And so oftentimes the retirement industry follows the real estate industry, and spring and fall are the hot times to make a move into retirement. So when we work with people, if that is their plan, we often look just before those time periods so that we can get them the best choice of suites. Oftentimes there's offers with COVID. We've been moving folks all through COVID, safely of course, but there has been new offers coming in and incentives to help people move to retirement. Also, a lot of the retirement homes change their pricing at the first of the year. So end of the year coming in now, there's going to be more incentives to move as the retirement homes are also a business, and they have certain numbers that they want to hit in their business. And so to do that, they also offer incentives at the end of the year. Where in town? This is exactly like real estate, location, location, location. Some locations are more expensive than others, and that will make a difference in your budgeting. But also on this note, where in the building may make a difference as well. If it's a specific view, if it's in the penthouse, all things to consider when you're having a look. Why did you wait so long? Now, I ask this to a lot of clients because, like Irene and Bill, sometimes people wait way past the point where they're going to be able to afford retirement living, and they may need to look at more of a crisis placement and long-term care. The longer that you wait, it's the more likely that you'll have higher, more expensive care needs. So that's something to take into your budgeting as well. How long are you going to stay there for? Are you going to look for a permanent residency, and are you going to be there for 10 years? Are you going to look for a respite opportunity where the loved one you are taking care of could possibly go into a home and do a respite for a month and you could get a break as a caregiver? Or are you possibly looking at a winter stay? A lot of my clients at this time of year start booking in for winter stays because the winter can be harder on people getting groceries, getting out, and the socialization. And so they often go into retirement living for 3 or 4 months and then go back home in the spring. And a bonus what? What care do you require as you age? So as I said, care does increase. And when you're looking at what care you need when you're going to move into a retirement home, you should also be asking what that looks like down the way so that you can keep your budget and you can keep in mind any additional costs that may come up. A question that we've been getting recently is, what about COVID outbreaks in retirement homes? Retirement homes, out of the total outbreaks, 60% of them have been a one staff member and no residents. Now, I get my information from Ottawa Public Health, and so this was a couple of days ago, but about 60% are only one staff member. But what that also means is that the whole home needs to go in outbreak status. So people see that a home's an outbreak and they assume that the whole home is sick, right, and is ill, but that's often not the case. The ones that have a resident outbreak, only 3 retirement homes have had higher than 10 residents, and the highest was 28 residents that were sick in that home. And I'm going to go over the nursing home stats in a couple of slides as well. But that's just to give you an idea of what's happening in retirement. So what's a nursing home? A nursing home, or a long-term care home, they're interchangeable terms, is a publicly subsidized home. Now, the city can own these homes, or private businesses can also own the nursing homes. They're more of a hospital-like setting or a facility-like setting, and they require a special type of roadmap to navigate. Spouses can't stay together as easily in nursing homes, and there is a whole system in order to get a spouse back together. And there are 3 different styles of beds in nursing homes that make the make the pricing differ, and I'm going to go over that as well. And in addition, there are subsidies available, and I'll talk to that as well. So room size. So these are the 3 different styles of rooms and the costs associated with long-term care or a nursing home. You have your basic room, which is the $18.91, which is the posted rate right now across Ontario. And they generally are 4 people in a room. They've also been called quad rooms or ward rooms. And this is what's been getting a lot of attention in the media recently. From there, you have your semi-private room, which is around $22.80, well, $22.80.04 is the posted rate. And that's when 2 people are in the same room. And these differ from home to home. Some have half walls dividing the 2 people, some only have curtains, some have shared bathrooms, and others have bathrooms outside the room. And when we help people go through and figure out their suite selections for long-term care, then this is the information that we go over so that they're clear on what they're looking for. And then there's private rooms. They're $27.01 is the posted rate. And again, as they say, they're private. So you have your own room and most often your own bathroom as well. Now, because of COVID, we've lost 800 beds in the Ontario system because the quad rooms have now been reduced to semi-privates. We're not sure quite what the pricing is going to be yet. However, because of this, we're expecting that there's still going to be a certain amount of rooms at the $18.91 pricing. Now, the backup is affecting retirement homes as well and the occupancy, so something else to consider. Right now, the nursing homes are only taking in crisis placements and they've lost 800 beds. And so if this is a scenario that you might be in, consider that this is happening in the industry. And if you're looking into retirement living, that's all the more reason to have a look sooner rather than later. Many people are scared of the news because there's a lot of confusion between long-term care and retirement. And one of the other questions we get are about the COVID outbreaks in nursing homes. And when I was looking at public health, out of the long-term care homes, out of the total outbreaks, 60% have been 1 staff and no residents. Again, the whole building needs to shut down for 2 weeks. So it looks like everyone is sick, but in most of the cases, it's not. The ones with resident outbreak, only 10 of them have been higher than 10 residents. However, the highest is 170 people, which is quite different than the retirement home industry. And I'm guessing that a lot of it is because of the basic rooms and semi-privates, where in retirement, most people have their own suite. So that is exacerbating it. And again, this is from Ottawa Public Health, the daily dashboard. Okay. So often I'm going to go over a couple of questions here. And one of them is, what if I run out of money? And we're speaking about long-term care and retirement, just going on the end of the last couple of slides. Now, this is the number 2 question that I get after what's the difference between retirement and long-term care. In a long-term care home, you would move to a basic room, and so you would be going down in price it that way. And then if you actually run out of money, then there are subsidies available to cover the entire cost of that room that's taken care of by the government. In retirement homes, my clients who are looking at different budgeting are either downsizing their room size, or they can look at moving to a different retirement home. There are different retirement homes that are less and more expensive, depending. Or they're going to look at being on the long-term care wait list and maybe even upping their status to crisis, depending on the situation for them personally. Meals and kitchens are also something that we talk about a lot. Now, of course, long-term care does not offer full kitchens, but retirement homes do. There's a handful of retirement homes in the Ottawa area that offer full kitchens, and there's also other homes on top of that can offer meal rebates, because a lot of people want to move to retirement, but they don't want to give up their own routines of getting breakfast and lunch made, and they want to be able to do that. Now, a lot of homes do have kitchenettes, but again, there are a handful that have full kitchens. And lastly, can I bring my pet is definitely on top of everybody's mind. It would be of mine. Long-term care, short answer is no, but the retirement homes, yes, most of them you can bring your pet. As long as you are able to take care of your pet, and if it's a dog, it's well behaved and it's small on the smaller side. And often there is a pet policy involved in the lease signing so that you're responsible, and sometimes you have to give a deposit based on that. So sorting out the details of long-term care is difficult and time-consuming. I've developed an online course to walk you through the entire process step by step. And if you're interested in receiving an email when the registration opens, be sure to head over to teaandtoast.ca/course to add your name to the list. This is what the registration page will look like so that you know that you're in the right place. Again, it's just to be notified when the course opens in the fall if you are interested, and it'll be fully to be able to walk you through the long-term care. Included in here, so you have an idea, are these 4 modules. What's a long-term care versus a nursing home? So there's more in-depth knowledge. Who are the LHIN and the whole process of the LHIN. Module 3 is long-term care and nursing home process, how to move, etc. And also module 4 is the care path and strategies to implement. So again, if you're interested, go ahead over to the course afterwards, and we'll put this in the follow-up thank you email so that you have this at your fingertips. Now, lastly, this is a good course if you have a fear of making the wrong decision because you're overwhelmed, or you're short on time, or you're confused by the terminology, you're unsure of the process, or you don't know any strategies, then I suggest having a look at this course just for a helpful hand. Now, for those that have stayed to the end, I can see 44 of you have made it to the end, so thank you so much for that. What we're going to do is we have a download available to you at teaandtoast.ca/download. Again, it's going to sorry, this one's not going to be in your email because you guys are special and you stayed for the whole time. So please write it down, teaandtoast.ca/download. Now, this is a document that I drew up, and it's called Things You Should Know, a book for planning and record keeping. And this is somewhere that you can put in your family contacts, your important phone numbers, your records. Also, you know, if you would like to have your funeral plans and things like that, as well as your wishes for retirement living and long-term care. And so you have access to this download, but also when you get over to the downloads page, you have access to a couple of other documents called retirement home definitions. There's a retirement home and nursing home PDF, and also a retirement home checklist that you can have a look. If you're actually looking into retirement living and you decide to do the research on your own, there's a checklist there that you can use. And then our early joiners win a free book, and these are Pierre and Magda and Christian. So I'm going to contact you separately to arrange to get your free book to you. And these are also available on teaandtoast.ca/ebook. Again, I'll send you the link for that in the next email that you'll get tomorrow, just so that you have everything. So we've come to our question and answer period. I do see there's some questions, so I'm just going to rearrange my screens so I can see the questions. 1 second. And I'm going to actually go on video here in a minute. So the very first question is, how long should I start planning? So how soon should I start planning? And you're going to want to start planning as soon as possible. It doesn't hurt to have a plan that is already running for you so that you don't have to worry down the way. And that's what that planning book really does help with. Okay, and so some of the questions the other questions that we have, let me just read over them for just a minute. So one is about insurance coverage for private home care. And so I don't have a lot of detail, but I can tell you that there is a long-term care insurance program. that is offered quite a bit through Sun Life, but also some other providers. And so there's two types of insurance. There's the long-term care insurance, which will give you, you're going to set your how much you are looking for, and then once you hit the needs that you need to have 2 out of 6 daily living things that you need to be taken care of, such as bathing or help getting out of bed and things like that, then you're able to put in motion your long-term care insurance. Now, with the other insurance, there's often on the Sun Life plans as well, and maybe on the other ones, there's often a clause in there for nursing service, and I believe it's up to $15,000 a year on nursing service. So you're going to want to check with your insurance brokers just to make sure and see if you actually have it. Let me read the next questions here. So staying at home, what about installing a stair lift? Yes, that's one of the things I mentioned on the previous slide. Stair lifts are becoming more popular, and there's definitely companies in town that you're able to hire to install a stair lift. It does depend on how complicated your stairs are. You know, some people have stairs that whirl a little bit more or that are short. So it just depends on all of that, but you're gonna have to bring in a professional for that as well. So what is the waiting time for long-term health care in Ontario? The waiting time is pretty significant at this point, and so it does depend on what long-term care home you are looking at. The wait times in town before COVID were anywhere from 6 months to 10 years, which is terrifying for a lot of people, and I totally understand that. Now, the wait times have been extended because of COVID, and now in our region, which is the Champlain-Lynn, only folks that are on the crisis placement are being placed in long-term care, and that wait list is still a couple of months, I believe, if not longer. And so the backup plan of retirement living has never been more pertinent, because a lot of people were doing that before, but because people are getting into a pickle of staying at home waiting for long-term care, you may need to do an interim step in the meantime. Let me look at the rest of the questions here. So it says, Amy, you mentioned long-term care insurance, but not disability tax credits. I think that people would like to know. Yes, of course. Disability tax credits, you can talk to your accountant with. Disability tax credits, I don't have a lot of information, and I do work with my accountant on that for people to get information, but basically it's something you need to apply for and goes in on your taxes. So also, when you're living in a retirement home, as an add-on to that, you can claim a lot of what you're paying in retirement living, the care portion of it, on your taxes. So for disability tax, as well as what you can claim in retirement living, you might want to speak to your accountant just to make sure that you have all the answers proper, and I don't mislead you on that, but they are definitely something that you can look into. So are there any other questions? I don't see any more, but I will give you guys just a couple of minutes to see if anything else comes up. Okay, so I don't see anything else coming up. So I'm going to thank you very much for staying and listening to the webinar, staying to the end, and Patricia's gonna hop on here on her camera now. To also say hello. 1 second here. You're on there, Patricia.
Thank you, Amy, for your excellent presentation. That was a wealth of very valuable information. You've given us lots of really helpful ideas about how to stay safe and remaining in our homes. Just to remind you all to watch for your information, for your inbox and your 2 emails coming in the next couple days. First, you will receive instructions from Amy on how to access this video, just in case you missed any of it or there was any problems with it, for recording the presentation. Second, Ottawa branch will send information on our upcoming webinars and on how you can participate in the mega drive and have a chance at winning that $10,000 I mentioned earlier for successfully referring new members. Please stay safe and take good care. Merci beaucoup.
Thanks very much. Okay, we'll end the webinar at that. And thank you very much for participating, and see you all again.